Hello, I'm Dr. Annalene Weston, dentolegal consultant at Dental Protection. Welcome to RiskBites, a series of podcasts created specifically for dental practitioners in Australia. RiskBites looks at key dentolegal risks and issues affecting dental practitioners across Australia and provides helpful advice and guidance on how to steer clear of them, leaving you free to provide safe and high-quality dental care for your patients. In this edition, my colleague Anita Kemp and I will be discussing the personal and professional boundaries around whether we should be friends with our patients on social media. When it comes to social media and the concept of social networking, it can get tricky for practitioners as we sit under the code of conduct that holds us to a higher standard than the general public. Anita, as a case manager for Dental Protection, what would you do to maintain professionalism in a world where social media platforms are considered mainstream communication tools?
Thanks, Annalene. This is a really relevant topic in today's digitally focused world, and to complicate things further, dental practices mostly rely on these platforms to attract and maintain their patient base. The challenge with social media is that it's egalitarian in its concept, giving the illusion that it's permissible for us to be connected. As practitioners, it's important to maintain boundaries without causing offence to patients who reach out to us via these networks. Maintaining positive working relationships is so important, and equally important is maintaining these boundaries to keep our private lives private.
So for those of us still trying to understand social media and all of its complexities, what would be the best way to describe it?
Annalene, I might defer this one to the Oxford Dictionary, who defines social media as websites and applications that enable users to create and share content or to participate in social networking. I also really like the definition by Investopia, which states that social networking is the use of internet-based social media sites to stay connected with friends, family, colleague, customers, or clients. Social networking can have a social purpose, a business purpose, or both, through sites like Facebook, Twitter, LinkedIn, and Instagram. These definitions help us to set the scene by beginning to tease out concepts such as what is social versus professional, and allowing us to explore the social relationship versus the therapeutic relationship. When we exchange the word professional for therapeutic, the boundaries of our practice become clearly defined, which we'll explore a little later. Often patients feel that it's appropriate to reach out and contact their health practitioners in regard to a host of health issues and queries through social media, whether via a post on their practice page or direct messaging. Consequently, research indicates that health professionals and dental practitioners are experiencing an increase in friend requests from their patients to connect not only professionally, but personally as well. In fact, for many patients, sending their dental practitioner a friend request seems like a reasonable and acceptable thing to do. Yet in most cases, it would be fair to assume that patients may not appreciate or perhaps comprehend the professional ramifications of extending a friend request, or for that matter, the personal and professional boundary breaches that could occur. The challenge for practitioners is to balance these privacy and boundary requirements by knowing when to draw the line between their professional profile and their personal profile.
And of course, this can lead to those boundary breaches we often refer to. Could you run us through how they occur, please, Anita?
Well, Annalene, according to the Dental Board's Code of Conduct, as professionals, we're expected to display a standard of behaviour that warrants trust and respect of the community, and this includes observing and practising the principles of ethical conduct. So broadly, professional boundaries are defined as limits or borders which exist to protect the space between professional power and client vulnerability, enabling practitioner and patient to engage safely and effectively in a therapeutic relationship. Now, due to the power imbalance inherent in the practitioner-patient relationship, the preservation of professional boundaries is key to preventing abuse of the relationship, promoting good care for patient or client, and importantly, protecting both parties.
And we do have such a unique relationship with our patients, one we term a therapeutic relationship, and this in itself has inherent value.
Look, it does. The overarching purpose and nature of any relationship between a dental practitioner and their patient is one that is therapeutic, which begs the question, does accepting a friend request or followers on our personal sites or platforms add to that therapeutic relationship? The therapeutic lens enables distance from the egalitarian norms that pervade social media and allows for preservation of the patient-practitioner relationship. A response to personal online requests can be as simple as saying, as a clinician, I cannot accept personal requests from patients as it affects the therapeutic relationship. This allows the practitioner to maintain their professional boundaries while also acknowledging that the patient's well-being care is at the centre of practice.
So Anita, can you give us a scenario that could potentially breach these boundaries?
Certainly, let's consider the following. You accept a friend request from a patient who has a high caries rate, and you notice that they are constantly posting photos of themselves consuming high sugary content and acidic drinks. When asked previously in conversations around diet, they denied these behaviours, stating that they preferred to drink water. Now, would it be appropriate to bring these posts up with them during the next appointment? Could this be viewed by the patient as confrontational? And on the flip side, as their dental practitioner, is it appropriate to ignore these posts and not instigate a conversation around diet and caries? And what if they didn't intend you to see these images? Could bringing them up affect your therapeutic relationship? Could this be considered as crossing professional boundaries?
Yes, and social media can also influence our professional reputation, can't it? And also lead to our professional integrity being called into dispute.
It can, and it's an easy mistake to make. Accepting friend requests can provide an avenue into your colleagues' and friends' personal worlds where they feel safe posting their personal views and content. If content shared on your profile is not to the patient's liking or conflicts with their values, they're likely to shift their perspective and view you as a professional in power, not as a friend, holding you to a higher accountability. In effect, accepting requests from a patient that often presents as a benign invitation can become a privacy issue for your friends and colleagues. The very real fact that posted information is seen, liked, and shared by others beyond the original intended recipients could have unintended consequences and potential ethical repercussions for your friends and colleagues, not just you. Likewise, if your friends' colleagues are unaware that you are online friends with your patients and by consequence provide access to comments made on your profile by them, could you inadvertently be breaching their privacy? Although we often share personal information with our patients around common interests, shared experience, and funny stories, the purpose is intentional with the design to build rapport. These conversations are often shared with some degree of discretion and in a clinical setting. Excessive disclosure through unfiltered access is unlikely to be of benefit to the therapeutic relationship and consequently could lead to boundary breaches. And dental professionals, like most people, share information on their personal social media accounts, which includes personal information, photos, links to websites, likes, and at times off-the-cuff comments shared between friends, families, and colleagues. Whilst made under the premise of personal interaction, any comment made by a practitioner that expresses their personal beliefs that patients may find contrary to their own vulnerabilities or personal sensitivities, things like politics, religion, or immunisation, could inadvertently breach the code of conduct.
And we have, of course, seen notifications to ARPRA where content from a private or personal social media feed has been screenshot and sent to provide evidence of how unprofessional or inappropriate a practitioner is. And from our experience, ARPRA do take a dim view of practitioners who fail to keep their professional boundaries on social media. So how then can we preserve the therapeutic relationship and navigate our way out of a friend request?
Well, if you do find yourself in a position of receiving a friend or other social media request, you might on one hand feel somewhat flattered, while on the other hand feel a little uncomfortable, concerned that not accepting a request might prove awkward or rude. However, as health professionals, we're not held to the same standard as our patients. As a profession, we're afforded special privileges that are not extended to our patients or society in general, and in return, we're expected to uphold these high ethical standards, which include maintaining professional boundaries, preserving the therapeutic relationship, and placing our patients' well-being and care above any concerns, beliefs, or feelings of our own. With this in mind, it would be prudent to interact with patients over social media in a professional capacity through a professional page.
Can you give us some practical tips to preserve therapeutic relationships?
Sure. As mentioned earlier, patients may not fully understand the professional ramifications of extending a friend request. So, consider separating professional, practice, and personal profiles on social media platforms and adjust your privacy settings. Change your name to a pseudonym, making it challenging for patients to access your personal page. You could speak to your patient, explain that as a health professional, you're governed by codes, guidelines, and standards that set out expectations of professional behaviours and professional boundaries, and these state that it's usually inappropriate to form personal relationships with patients. You could send a polite message explaining that the practice has a professional policy not to accept patient friend requests or establish online friendships with patients, and this sets the tone and expectation for the patient.
So would it be fair to say then, Anita, that as all forms of social media have become so intertwined with our social fabric, managing social media on both a personal and professional level has become increasingly important? Similarly, it's imperative we attempt to construct and maintain professional boundaries with various forms of social media, as well as our interactions with our patients across this platform.
Look at Wood, and in a situation where a practitioner's professional behaviour or conduct was to come under review with regards to boundary breaches relating to interactions over social media, please know that it's irrelevant if the breach was inadvertently remiss, altruistic, or well-meaning. It's still a boundary breach and effectively a breach of the board's code of conduct, which often carry with it far-reaching consequences for the practitioner.
So, if in any doubt, err on the side of caution. Choose to maintain the therapeutic relationship and not the friendship?
Exactly, Annalene.
Well, thank you so much, Anita, for joining us today and for providing valuable input on personal and professional boundaries with social media. For listeners wanting further resources on this topic, please visit our website, dentalprotection.org. If you like Dental Protection podcasts and you'd like to hear more, please subscribe and leave a review.